Hi, my name is Carly Auer, and I'm a classical homeopath at Our Family Homeopathy in Mesa, Arizona. I have two children who have been raised on homeopathic medicine. Homeopathy has been such a gift in our lives, and I'm so happy today to be here to share it with you. I'm a graduate of the American Medical College of Homeopathy in Phoenix, Arizona, and on behalf of AMCH, we would like to welcome you to our new self-help homeopathy program. I invite you to visit us at selfhelphomeopathy.com. We have 30 different programs in a variety of topics, from acute back pain to cold and flu to autism spectrum disorders. The great thing about these programs is that in addition to focusing on a specific ailment, they also offer an introduction to general homeopathic and holistic medicine. So if you've ever wanted to learn about homeopathy and how it can help you, this is a great place to start. Visit us at selfhelphomeopathy.com.
Here is a brief clip from this program suggesting homeopathic remedies that are useful in treating this condition.
What I've done is I've broken down the remedies into two types. First of all, the main remedies. And there are only 4 that I've listed, which are the ones that I use most commonly to help with grief. And then a listing of other remedies and the indications when they may be indicated. So perhaps the most well-known homeopathic remedy for grief is Ignatia amara, or St. Ignatius bean. This is a substance that grows in South America, and is particularly useful for grief that is combined with hysteria, where an individual has just lost control of their emotions, and the emotions are flooding out, and they're inappropriate for the situation, and they just cannot control them at all. It's also useful for an individual who keeps trying to control their grief and to suppress it, but the grief keeps flooding out in inappropriate times and inappropriate places. These people are vulnerable to grief, people who need Ignatia, because they oftentimes are somewhat idealistic and romantic individuals. And individuals who are idealistic and romantic are particularly vulnerable to grief because they hold on to these values and these ideals and their romance so strongly. These individuals can, in their grief, feel that life isn't worth living and even have impulsive suicidal thoughts. It's also a remedy to consider for someone who has been never well since grief. So, for example, an individual who has developed lupus, an autoimmune disorder, right after the loss of a child. And they've had this condition for 20 years, and lupus they've never been able to recover from. But it had a direct association with the loss. So that kind of story makes you think of the remedy Ignatia amara. With their grieving, Ignatia will oftentimes have very long and prolonged sighs that are audible. And their moods, as I said, tend to be somewhat unstable. They can be quite happy and cheerful one moment, and then in the depths of sadness and grieving the next. Particularly useful for romantic disappointments, although it can be very useful for loss of an ideal as well. After the initial stages of grieving, they may hide their grief or hide their depression. And it can be a remedy that can go into complicated grief. And oftentimes they will describe feeling trapped by life circumstances with their grief.